Hello, my name is Carmela DeBeer, and I'm going to talk to you today about the nursing issue of compassion fatigue. When talking about compassion fatigue, I'm going to focus on caring for the caregiver. And the community that we are going to be dealing with is a level 1 trauma center. The trauma center I will use throughout this example has nurses that work in the trauma bay, the ICU, and the emergency room. When we talk about the community and culture, we must look at what nursing is. Nursing encompasses autonomous and collaborative care of individuals of all ages. It involves families, groups, and communities. It is taking care of both the sick and the well, and it includes promotion of health, preventing illness, and the care of ill, disabled, and dying people. When we talk about nurses and the community or the culture that exists within that level 1 hospital, within the ED, the ICU, and the trauma bay, there is a level of caring and compassion. It's a culture that puts the patient first. It's attending to the physical and emotional needs of others, but it's often a culture where the nurses lack physical and emotional self-care. Nurses so often put everybody else before them, not just in their jobs, but at home and throughout their daily lives, inside and outside of the hospital. And often caring for themselves and recognizing the degree of stress which they're under while they're at work is often something that they don't think about and they don't actively do and make a priority. When we talk about compassion fatigue, we need to look at what is compassion fatigue. Compassion fatigue is actually comprised of 3 different components that, when put together, put the nurse at risk for true compassion fatigue. The first component is burnout, secondary traumatic stress, and finally, we have to look at compassion satisfaction, which, when combined with burnout and secondary traumatic stress, often leads to compassion dissatisfaction. So let's look at what these are. Compassion fatigue is an extremely intense feeling experienced by those who care for people who are in distress. It is measured by 3 components, and those are the components that we talked about: burnout, secondary traumatic stress, and compassion fatigue. Compassion satisfaction is the meaning and joy that nurses get from taking care of other patients in their time of need. Secondary traumatic stress is due to duress from repeated care of the trauma patient or seriously ill patient. And this stress can lead to despair and feelings of despair that can elicit both physical and psychological symptoms. And finally, the component that we most often talk about in hospital situations, or maybe most familiar with, and that is burnout. And burnout is directly linked to the work environment and to job satisfaction. It is the experience that perceived demands exceed perceived resources. And I think that this is probably, like I said, the most recognized component. Because we all know in today's workforce, the focus is often on budgeting and that financial bottom line. So who is affected and why is it important? Well, who is affected is the nurses. the nurses who work in high stress and high acuity areas. And these areas are identified in our hospital that we're using as the example as the trauma bay, the emergency department, and the ICU. These nurses are prone to some element of compassion fatigue because these are areas of high stress where they see traumatic injuries or may care for people who have been involved in a traumatic injury or have a very serious illness for very prolonged periods of time. Increases in compassion fatigue lead to burnout and poor nursing retention. So if you remember those components of job satisfaction or dissatisfaction and burnout and secondary traumatic stress, all those lead to compassion fatigue. And when that compassion fatigue happens, or even if you don't get that far, when that burnout happens and that job dissatisfaction happens, then you have nurses who leave for other jobs or who maybe leave the profession. This creates an impact on the patient, on the culture and community of the nurses within the hospital, and on the community as a whole outside of the hospital. High levels of stress can lead to compassion fatigue and depersonalization. In other words, nurses who suffer from compassion fatigue due to stress start to elicit lack of compassion for the patients they take care of. Institutional awareness and implementation of recognition programs is paramount to dealing with compassion fatigue. There also needs to be a way to teach coping mechanisms that can help lower rates of compassion fatigue and increase the rate of compassion satisfaction. When we talk about why this is important, we have to look at what happens with compassion satisfaction, or what will increase compassion satisfaction. Rest, relaxation, social support, exercise, transformative leadership, and meaningful recognition in nurse engagement are all things that can help to increase compassion satisfaction. However, issues such as poor staffing, increased workload, high acuity, patient death, unexpected patient outcomes, and lack of leadership support can all lead to compassion dissatisfaction. And that is why this is an issue. One of the biggest reasons that compassion fatigue gets to be an issue, or all those components are allowed to add up and create an atmosphere of compassion fatigue for that particular nurse, is because there's a failure to acknowledge that compassion fatigue is real and that it exists within your hospital environment. Often it is not recognized and not acknowledged. There are no or very few programs in place to recognize nurses or to help nurses when they do experience the burnout and the dissatisfaction and ultimately compassion fatigue. And again, budget constraints. Very, very often the financial line is what drives the hospital administration and affects staffing and nurses at a unit level. So what is the social impact? When discussing with nursing leadership about compassion fatigue, burnout, and job dissatisfaction, one member of nursing administration, who was actually the chief nursing officer, had just attended a Disney workshop on how to have an atmosphere or a job environment that promoted your staff, that encouraged your staff, that helped retain your staff. And it was put on by Disney because they have some of the highest job retention. And one of the reasons she said that happened was because they focused on the person. They recognized each and every member of the staff from bottom to top on the same level. They referred to everybody as a cast member. You might have been on stage or you might be off stage. You might be the girl dressed up in the princess costume that goes out and interacts with the public and takes pictures with all the little kids. That would be one of the onstage cast members. Or you might be the gentleman who is picking up the trash and doing the maintenance. And even though they're off stage, they're just as important to that Disney corporation. And she talked about how important that was. What the takeaway that she took from that conference was, how do we make the nurses and the staff on every level, not just nursing, but all of the interdisciplinary workers within the hospital feel like they are meaningful, they are important, and they are appreciated. When I spoke with one of the directors over the nursing staff in particular, she talked about budget and how budget drives everything at this current moment. How everything is based on that bottom line. And how that directly affects patient satisfaction, nursing retention, all the things we've talked about that culminate in that compassion fatigue. So what is the social impact? We need to have counseling services. Our hospital that we're using as an example does have and does provide counseling services through their health care program. They do have unit-specific debriefings, but we need to make a change. We need to look to more nurse-driven, hospital-wide debriefing. And we need to have that change in culture where budget isn't everything. Where even though it's important, even though you have to meet those bottom lines, the culture within the hospital focuses on the nurses and the patients and not on that financial number. So who gets help? Currently, many hospitals lack recognition programs to recognize nurses, either on units in stressful situations for the job they've done for that patient, or major recognition programs that acknowledge individual nurses. Nurses within the healthcare system are the focus of programs based on combating compassion fatigue. And again, we've talked about unit-specific debriefings where nurses are allowed to have that time with their peers in an organized environment on a voluntary basis to talk about whatever the situation might be. It could be a child who's died, or a family that has all been in an accident, or just an overall culmination of having a unit full of very sick patients that has just put the staff at a new level of stress. And they're able to talk about it and talk through it in an environment where they feel comfortable with their peers. So those unit-specific debriefings are available, but we need to move to more hospital-wide. We talked about the counseling services that are available, but most programs to combat compassion fatigue don't combat it. They're secondary and tertiary. They look at it when they happen. They try to prevent it from getting worse. But it needs to move to a culture of preventative programs. that stop it before it happens, that combat that dissatisfaction, that combat that burnout, and that focus on the nurses as individuals and not on that bottom line of financial. So what are some of the strengths and weaknesses of the hospital that we're speaking of for the purpose of this particular presentation and of hospitals nationwide? Many have those unit-specific debriefing. Many do have recognition programs for employees, and many have employee counseling availability. Some of the weaknesses are budget constraints, staffing issues, and nurse-to-patient ratios, and finally, lack of acknowledgement of compassion fatigue as an issue and acknowledgement of the components that make up compassion fatigue and lead to full-blown compassion fatigue. So finally, what are some recommendations? What can we do to get on top of this and to combat this? First of all, we have to acknowledge that it exists. Secondly, we need to have recognition programs. Third, we have to have improvements to staffing and budgeting that allow for ratios that are better for nurses to take care of their patients, to feel like they're fulfilling their jobs, to have that satisfaction in the job they do. And finally, we need those peer-led support networks and debriefings. We need to have systems where peers who are either voted on or picked by their units as the leaders and those that are trusted are given training so that they can be one-on-one in individual situations and group situations to help be an ear to listen or to come up with solutions to issues that are going to lead to that burnout and that dissatisfaction. They need to be trained so that they're the ones, the nurses, nurse-driven leadership of debriefing, and that those debriefings are hospital-wide, that they're provided when the nurses need them, and that there's a recognition that they're needed, that there's a time given for those, and that nurses are allowed to have that time to focus on their self. We need to get to a culture where we actually care for the caregiver. Thank you very much for listening and for your time.